In this study, we are trying to evaluate the association between the germline mutations in DNA repair gene, especially for BRCA1, BRCA2, and ATM mutations, and the lethal prostate cancer. So in our study, we basically sequencing nearly 800 patients with more than 300 lethal prostate cancer patients. So we look at the germline mutation rates of that three genes. We can find out that in lethal prostate cancer patients, the carrier rates is much higher than those with indolent prostate cancer. Also, if you look at the survival analysis, you can see that for the patients carrying those kind of germline mutations in those three genes, they will have a much significantly shorter survival time from prostate cancer, which the median survival time is 5 years versus 16 years. As you know, the prostate cancer is a very indolent, slow progress disease. So like died within 5 years is really significant. So then we look at a little bit more about other DNA repair genes like CHET2 or like the mutations in Lynch syndrome genes. We didn't find any significant result, but we do find is that if the genes got inherited pattern, which is dominant inherited pattern, it's do associated with prostate cancer death. There are several aspects, as I think. So first one is for healthy population. If there's a chance in the future, we can sequence every people for those genes. If we find out those who carry such kind of genes, they may start earlier PSA screening actually. Like in the United States, they already recommend against the PSA screening. So we need to pick out those patients or those populations with higher risk. That when we talk about higher risk, there are three aspects. One is that with positive family history, and second with a little bit increased inherited risk that contributed by the common variants that as we know, is the single nucleotide polymorphisms. And the third one is that some kind of rare mutations that with high penetrance, that's what I'm looking for. The second aspect is that for the earlier stage of disease, if you can sequence those patients with these germline genes, then you can find out if they are truly at a high risk to progress, to have a aggressive prostate cancer. Then you can probably treat them in a more aggressive way. Thirdly is that for those late stage patients, if they carry such kind of mutations in DNA repair genes, they may probably suitable for the most popular target therapy that called PARP2 inhibitor. They may benefit from such kind of drugs. Up to now, it has already reported like nearly 200 DNA repair genes. So we are going to evaluate all that 200 DNA repair genes in our study population and in a more larger study population. Also, we are going to look at the DNA repair gene, germline DNA repair genes, the association between the mutations and the progression or the survival in the active surveillance population. We will see if the patient carry such kind of mutations, although they have very low clinical risk, if they are going to progress in the future.